The information in the podcast is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Please talk to a medical professional before doing anything that may impact your health. Hello, welcome to my podcast, Two Mics from Joey Suit. I am Joey Suit, and I will be giving a mic to Annie-Danielle Grenier. She currently has a few rare diseases. One is hypermobile Ehlers-Danlos Syndrome. Common symptoms include joints becoming dislocated, affecting elbows, knees, fingers, and toes. Also include soft, smooth skin that may be slightly elastic and bruises easily, while with chronic muscle and bone pain. It is not to get confused with the classic Ehlers-Danlos Syndrome, which is usually more severe. Also has autoimmune inflammatory diseases. It means her body is attacking itself for some strange reason. Also has adrenaline insufficiency. Her body is producing too little cortisol or none at all, and often too little aldosterone. Sorry, I'm butchering this up. Symptoms include extreme fatigue, weight loss, darkening of skin, low blood sugar, nausea, diarrhea, or vomiting, muscle pains, and body hair loss. That's a lot, but welcome to the podcast. How are you?
I'm good, thanks. Yeah, it is. Those diagnoses are mouthfuls and a lot to handle as well.
We were talking in the private chat before this that while yes, I listed a lot of symptoms, it's of course it's not the same for everyone. Some may have half a list, 3 of them, all.
Yeah, well, actually, just Ehlers-Danlos syndromes in themselves, there are 14 different types, and the hypermobile type is the most common, but they're so varied. Someone with the classical type may have it easier than some with the less severe type, because when they give the definitions, they go for the most common, but someone with the hypermobile type might be affected more severely than someone with the classical type, because it depends on how you're affected. Mostly hypermobile type, your joints are more affected, your skin is less affected, internal organs usually are less affected, but it's really a multisystemic problem because it's our connective tissue, and we have it's our collagen that is defective. We have that in 80% of our bodies. So our eyes can be affected, our digestive system, our skin, everything.
How could there be?
It's more than just joints.
Yeah, how could there be 14 different kinds though?
Well, I think the more they're starting to do research, the more they discover, and then they discover, whoops, there's this gene, and and they try to like put the criteria, and they discovered it's not exactly the same as in those people, and they kind of make a category. And I think that's how they come up with that. And I don't fit with the people who have that gene, so it makes sense. It's just that maybe in 10 years with more research, they'll find out that it's really not all under the same umbrella anymore. Things change, but I don't know. It's because of the genes so far. They discovered genes, and they divide it because the genes don't affect exactly the same type of collagen. That's the really more scientific stuff, but that's the reason why it's now up to 14.
Oh my God, it sounds so when I read it, it sounds easy to say, but I guess when you go into the science of it, it gets way more complicated and way more 14 though for one overall disease. That's crazy.
Yeah, but I think most diseases are more complicated than we think. Even I don't know, multiple sclerosis. It's something I learned a bit about because I have a friend who suffers from it. And I didn't know there were more than one type, but there is. So
really?
I think, I wouldn't start explaining because I don't know more than that, but I know there are more than one type. I think it's the reality for most health problems. What I know though is, and one of the reasons why I'm doing advocacy is the diagnosis for people with EDS Ehlers-Danlos syndromes, is very long. And one of the reasons is most doctors think it's just a hyperlaxity, hypermobility problem. So when people present with symptoms like more complex, like what was my problem, I had cardiovascular problems, and they did not think at all to relate that with my joint problems or, you know, and so we can spend years in this medical system going from doctor to doctor and being told it's in our head, and they don't even think to connect the dots, because even if they notice that we're hypermobile, they don't think it's more than that. Doctors told me, yeah, you're flexible, but it doesn't cause pain. Except, yeah, because it causes dislocations, subluxations, and those create muscle tears or ligament tears, and that's painful. It's a lack of knowledge that causes a lot of problems down the line. Had I been diagnosed at like 3, many things I would have done differently. Many treatments I would have gotten, and I might have been.
So since you were, I guess, misdiagnosed, what procedures have you had gone through that could have prevented future problems?
Well, it's not really procedures, it's more the opposite. Some procedures would have not been done, or been done more carefully, because our skin tears easily, or the ligaments tear and we don't heal well. So that's part of it, but it's more on the preventative side. The stretch, I was a dancer. Dancing is not necessarily a bad thing, but I would not have stretched to my limit. That was a bad thing. Some sports are really not good when you have EDS. So I hurt myself, not necessarily doing sports, but it made my joints more prone to injuries later. And it's more of I would have needed some orthesis, some braces, and I didn't get them until I got injured. And so it's more of I would have learned not how to live, but a way to be more body conscious, maybe, because it's often a way to prevent injuries in the day-to-day, in the way normal people don't have to. But like opening a can, I can dislocate my thumb, and
What?
I wasn't, yeah. or a joint, like these joints dislocate easily too. So it's things that didn't happen when I was younger. Although that's when I was saying we're not all the same. Some kids with EDS, it happens to them. It didn't start happening to me until I was like 30. It's always, it's not the same for everyone, but maybe if I'd been more careful, if I knew better earlier, it would not happen now. So we don't know. Physiotherapy could have maybe strengthened some muscles to help. But of course, you can't really strengthen your fingers that much. You can, some exercises, but it's not just about strengthening muscles either. There are limits to that.
Yeah, I had to actually interview someone with EDS. I'm somewhat familiar, but the audience isn't. And there seems to be a disconnect or stuff that still needs to be studied more, that you mentioned exercising, because the other guest was saying that the doctor told her, don't go to the gym, don't do sport, it's dangerous for you, like growing up, but like she loves sports, and like what do you do to a kid, like don't do sports? So she did sport, and then it turns out later that her actually doing sports and going to the gym is actually helpful, because like you mentioned, it strengthened her muscle, and she's actually better off now, because I think the muscle, I don't know if it helps like the bones from dislocating, or less stress or something. Maybe you can fill in the blank.
I think it's a combination. I'm guessing like going to American football and being hit would not be good. But then again, if it's what makes you happy and you know the risks, maybe it's worth it anyway. I wouldn't judge. But I can speak for dance. It's always said that, dance is the worst because, it's a stretch sport, if I can say it like that. I would not have stretched as much as I did, I pushed my hips to dislocate, I guess, in a way, and that's bad. But
When you say
I
dance,
remember,
when you say
yeah,
dancing, do you mean like ballet dancing or
I did ballet, I did jazz, I did Broadway stuff. Yeah,
like
musical
you
theater.
really went like the full stretching motions?
Yeah, ballet wasn't good for that. At the same time, it helped me with the body awareness where I'm in the space, which is a problem with many having EDS. The thinking is that since our joints are hypermobile, we don't get the feedback that normal people do from the joints related to the muscles related to the ligaments. So normal people get that feedback from all that to the brain, and if you close your eyes, you know where you're at and all that. It's not that if we close our eyes, we don't know where our hands are, but we kind of often miss the spot, and so we hit the door frames and tables and stuff. So dance and other sports also help us with that, because we need to figure out where we are in space to play sports, to dance, to move. So it helps with that feedback, and it helps strengthening the muscles around the joints. It might not prevent all injuries, but I know personally I never injured myself while dancing. Well, not
Wow.
until later when I would injure myself walking, so I would injure myself dancing as well. But not it took a while, because before I injured myself, I would injure myself falling down the stairs or running or playing with a friend or stuff like that. In phys ed, every year when I would play basketball or something, the ball would hit my fingers, extended fingers, and I would dislocate one, but never dancing. So I guess it's not that bad.
I mean, would you say that, like, it blew my mind that she said a lot of acrobatics have some sort of EDS in them that allows them to be very flexible. So did you have, I guess, a competitive edge over your competition then?
Well, we didn't do competition. It didn't really exist here back then. But I wasn't necessarily flexible in the right way. My hips would turn out, but I would not be able to do some other moves. So it depends. Indeed, a lot of gymnasts or dancers are hypermobile, but being hypermobile isn't always having EDS. There's like a spectrum of hypermobility, and you might have just like elbow hypermobility, and you won't have pain, you won't dislocate, it won't cause you any problem. That's that. With EDS, you might have well, to get the diagnosis, you need to have other criteria, and that's where the knowledge needs to be, because there are other multi-systemic problems that come into account.
So it seems like in your case, so let's say everyone is born with 100% collagen, and then over time the number lowers, and for some people it lowers more than others. Is that a good explanation for EDS?
No, I'd say we're born with a defective collagen, and I think for most of us it gets worse as we age because the injuries repeat. So for example, when I was a kid, I would just roll around my ankles while running, so it was like painful, but it didn't last. When I was a teenager, I would sprained my ankle, but it wasn't too bad. And when I was in my 20s, the ligament teared. So, and now I need surgeries because too many have torn. So it's not my collagen didn't get worse. It's the structure that got worse as the years went on.
That does make sense. It's weird for you that you didn't start experiencing anything till you were 30s. And
Well, I did, but it wasn't as obvious. Yeah.
Yeah, and some, like the guys I was talking to was in her early 20s, and she goes into bed and she wakes up with dislocated hip?
Yeah, I'm lucky, knocking on wood. My hips rarely totally dislocate, but it started to, and I'm now in my 40s. My ankles starting dislocating in my sleep in my 30s. Spontaneous or almost spontaneous dislocations didn't happen until my mid 30s, I'd say. But I had injuries from when I was a kid, but we just didn't even think about it. I was just the unlucky one or the weak one. I would be the one to roll my ankles or sprain something and sprain a finger every year in phys ed. It was not something we thought about. I just had a lot of x-rays that never showed any broken bones.
Let's say you rolled your ankle when you're younger. It would look like a normal ankle sprain, right? I
It
wouldn't.
was very young. It wasn't even a sprain. Like it wouldn't swell, and I would be able to walk on it the next day, and it just hurt for a bit. But
I mean,
it was never stable. Like my friends would never roll their ankle.
Sometimes I roll my ankle just walking down the street.
Well, my friends didn't, and I realize now that I had dislocations in my feet or ankles back then, but well, quite young. I remember walking and then having sharp pain, and it felt like my bone wasn't in its place, but it didn't make sense. It wasn't possible. Tell anyone, hey, my bone is not is its place, and yeah, right. You were just walking. It's impossible.
Yeah.
But now I know that, yeah, it's actually a dislocation or subluxation, and it goes back in its place, and I'm okay. But it's been happening for decades, and I didn't know it was the issue.
So, like, how do you know when a dislocation requires like a hospital visit versus at home?
So far, it never has. I was lucky the way it happened. It was gradually over time. At first, it was just subluxation, so partial dislocation. For example, if that's my shoulder or knee or whatever, it's the socket and the bone. And partial or subluxation is like it's kind of off and it doesn't feel good, but it's not completely off. And that's what used to happen. And I have a great doctor in sports medicine, and he's been following me since the early 2000s. And I would talk to him about how it felt and how it happened. And he explained to me what was happening and that probably it would completely dislocate soon. And he told me how to get it back in if it didn't on its own. But the upside of our problem is usually it goes back on its own because it's so loose. So it's what happened a few months later, and yeah, it hurts like hell, and we need to like brace it or put a sling if it's the shoulder. And yeah, I usually do that when it's and I want to say a new one, because the thing is, if that dislocation happens often enough in the same motion, it stops hurting as much as if it's the first time ever. So sometimes a subluxation, so a partial one, might hurt more than a complete dislocation that you are used to. And so I used to think if it hurts more, it's a dislocation, and if it doesn't hurt as much, it's a subluxation. But I learned that's not the case. And so, but yeah, usually it goes back in the spot, or if it doesn't, but it's not life-threatening, I just take muscle relaxants, I brace it or put a sling or whatever, depending on where it is. And I wait for it to go back, because stress or, muscle clenching or whatever, like if it's the jaw, because it happens with the jaw also, it just won't have it go back. You need to relax for the joint to go back in its spot. So usually it takes a few days or one night and you're okay. Sometimes it takes moving a certain way. You learn how to pop it back up. And once or twice I went to the hospital, not necessarily for that, but asked to please help. And sometimes it was already back in, but still painful. So, and feeling not right because of the swelling, but it was in its place. And sometimes the doctors in the ER didn't even know, yeah, I don't know how to place it again because, it was like a rib or my jaw. It's not the usual shoulder things. They couldn't do anything. So, and it doesn't last. That's the problem also. I would be in the hospital every day if I went every time I dislocate something.
So you're saying that when it's partial, it doesn't hurt?
No, it does. It does. That's I mean the contrary. Sometimes a partial dislocation hurts more than a complete one, because if it's my shoulders, for example, dislocate completely almost every day, but it's not as painful as sometimes when they don't completely dislocate, but it's not exactly in the same movement.
Yeah, so you say that you let the body like put it back into place. Do you ever just do it yourself? Because like I'm a huge WWE fan, and sometimes wrestlers will dislocate their elbow, they'll dislocate their shoulder, and like during the middle of a match, they'll like pop it back in. And it's like the most craziest thing. Like, I mean, I guess it's easier for them because there's so much adrenaline that maybe they just don't feel it.
Yeah.
Like,
I'm sure they feel it, but also sometimes it hurts more later too, especially with adrenaline. But
I mean,
you still feel it.
But like if you have a partial dislocated shoulder, wouldn't it be best to put it back into place as soon as possible?
Yeah, you always try to put it back, but when I wait, it's because I'm not able to.
Okay, that makes sense. I was just wondering why you would wait a couple of days to let it.
No, I don't wait. It's just that when it takes a few days, I'm still like I can try every 5 minutes. It's just because it doesn't feel right and it hurts, and you're trying to put it back, but it won't.
So if you like dislocate your shoulder, let's say, does that mean that your shoulder is like completely immobile?
No, it's because they're completely unstable. And the problem is, if I immobilize it with a sling, for example, I need to use my other arm to compensate, but they're both unstable. So if I'm waiting for a surgery on the left one, but the right one is almost as bad. So we know that about 1 year or two after the surgery, we'll have to do the other one, because while I rest the one we operate on, I'll have to use too much to compensate, and then I'll have ruined it. Because Ehlers-Danlos is often like a domino effect, because all our joints are bad. Some are not as bad, but overuse is our problem. But overuse is very easy it's easy to get to overuse. It doesn't have to be like hours of doing the same thing over and over again. It might be just using the phone or playing on the iPad or working on the computer, or it doesn't have to be nothing too crazy.
Yeah, my other guest said that she dislocated her shoulder just opening a door. And it's just like she's trying to be nice for a person, but then it's like now she's in pain for like a whole month.
Yeah.
And it's like that, like it's like you want to be nice, but it's like also like it's so like I don't know, like rude, I guess, or something. Like you're trying to be helpful, but like at the same time you're like, do I want to risk this one movement, for pain? So are you in pain now?
Of course. Especially since I have my other health issues. So it's not just Ehlers-Danlos. So actually my Ehlers-Danlos syndrome is I say I have 3 umbrella problems. The Ehlers-Danlos causes more comorbidities, but my immune disease which still is unspecified, but causes other problems, including pain. And my adrenal insufficiency causes, well, I don't really have comorbidities associated with it, but it's really impacting my life a lot too. So it's super complicated. When I see a new doctor, it takes forever just going over the current diagnoses and medication. But it's, yeah, I have multiple problems causing pain, not just the injuries in themselves.
So diseases never really come alone. One disease seems to be a domino brother. Future diseases are just waiting to make a surprise attack. When we get older, I don't want someone to go, OMG, I have 2 of these symptoms and I have X disease. Diseases are complicated. Like I could have nausea and then be like, OMG, I'm pregnant. Great, just what I need in my life. So let's start from the beginning. So I'm guessing your first disease was Ehlers-Danlos Syndrome, right?
Yeah, it was the first since I was born with it, but I was only diagnosed at 29. Although now I'm told I have primary immunodeficiency, so I was probably born with that one as well. I did catch everything going around from when I was a kid: bronchitis, pneumonias, earaches, and all. 1 year I was sick half of the school year, so that would make sense as a diagnosis, and probably the cause of other ones, but it's recent, so that one would be the record of 42 years before a diagnosis. And then due to the Ehlers-Danlos, I have gastroparesis, which is a digestive problem. I can't go chronologically. It's easier if I go from head to toe, because it's too much back and forth with when I got symptoms and when I got diagnosed. So if I go from head, I have migraines, I have cognitive dysfunctions, and I have a problem with my eyes. My cornea is getting deformed. I'm sorry, I'm losing the word. So I had 2 surgeries, one for each eye, to stop the progression of the disease. And now I need to wear special contacts to be able to see clearly. Glasses can't work for that. What else? I have asthma. I have allergies. I have arrhythmia. One of the bigger problems is I have POTS, which is tachycardia. Postural orthostatic tachycardia syndrome, which is basically if I stand up too long, I faint.
And, I literally did an interview with someone on that, some all into that world, but I'm glad you explained it to the audience that don't know what it is.
That luckily that one is I'm quite good because I have medication for this, so it's much better than it used to be. So gastroparesis. I've had a precancerous condition last year, so I don't have a uterus anymore. So I have that removed. One more surgery. I had kidney stones last year. Well, I had 6 surgeries in the last few years. So that was nice. I don't have a gallstone anymore. I had gallstones. I don't have gallbladder. There you go. I don't have a gallbladder anymore either. And
you sound like you're like on a TV show, like House or something.
And due to the EDS, I have osteoarthritis, of course. I think we all do at some point. And I have what's called erythromelalgia, which is an inflammatory problem with the hands and the feet. And I also have a small fiber neuropathy, which also often comes with the other one. I think I pretty much summed it up.
I'm surprised you remember everything.
No, I don't. I'm sure. I'm sure, Mr. Chu.
No, so like, well, I never asked this question before. It's like, what disease would you not want to have if you could pick?
Adrenal insufficiency, because I have to. Uh, it's like diabetes, except instead of insulin, it's cortisol and aldosterone for my part. But unlike diabetes, we don't have the possibility to prick our fingers to check our cortisol levels. So we only rely on our symptoms to know if we need more medication. We can, well, we shouldn't take more like in a preventative measure. It's only when we feel bad, we need to take some because it's a bit too late. And if we wait too long and it's really too late, we get into crisis and then we need to use an injection. But again, unlike with diabetes or with allergies, it's not an easy injection. It's a syringe that in the little bottle you need to mix, and it's like 15 steps, I think, to do the injection, and EMTs are not allowed to do it for us. So if I'm unconscious, nobody really can do this until except like my boyfriend or my parents. Someone on the street will probably never be willing to give me the injection, even if I have the leaflet explaining how, because who would do that, I don't think I'd feel safe doing that for a stranger, using a syringe and everything. And so it's really dangerous, and I can die from that. A simple stomach flu can kill me. It complicates all my other health problems, and it's another rare diseases. Doctors, nurses, they don't understand how it works. Often they don't know a lot about it. I've been close to death because of the lack of knowledge. They almost killed me in the hospital a few times. Yeah.
Just because you have low levels of the thing that you need to shop for, what is it called?
It's cortisol.
So it seems way more rigorous than I thought it'd be. So you have a bottle and you have to inject yourself with a needle. No, It's not as easy as if you have diabetes. You just have the thing and you can just do it in 30 seconds. And
yeah, it's not an auto injector.
So how often do you have to do it then?
I'm lucky it never happened. I've used it, but like in the morning before a surgery, for example, because you have to not eat or drink before a surgery, so you inject. But in the case of an emergency, it never happened to me yet. Some people go their whole lives without needing it, but it's the knowing that in case of emergency, I might not be able to do that, because especially when you get close to a crisis, you get confused, you have trouble concentrating, trouble moving, you get sleepy and not tired, but like really sleepy. It's like someone drunk, very drunk, I guess. I've never drunk, but never drank, I mean. But I guess that's what it is. And so it's the knowing that not having that injection could kill me. It's really frustrating, but it's a rare disease. So that's the money or the interest has never been there. Now there is one that's been authorized, I think. So maybe in a few years we will have one, but it's not here yet.
So is this something that you worry about often? Like, do you have it in your bag at all times?
Oh yeah, I have, well, with COVID, I'm not going out, but and it's one of the reasons why I'm not going out due to COVID. But I used to have one in my bag. We have one in the bathroom, easy to reach at all times, and I never leave the house without at least my meds if we just go around.
So how is the maintenance then? Do you just take a pill once a day and you're good to go?
No, it depends, because like in Europe, I think they have now a slow release med, so they can do that. The type of med that is the most commonly used, it only lasts for like 4 to 6 hours in your body. So some people have really slow metabolism and can do only 1 or 2 pills a day, 12 hours apart. But I take it 5 times a day. I need to wake up in the middle of the night to take one, or when I wake up in the morning, I'm close to crisis because I'm at 0. Yeah, I need to take some meds at 4 a.m. too.
Oh my God, it sounds so dangerous that you're playing with your life every single day.
Yeah, it's. I guess that's one way to see it.
So there could be like a chance, like I'm sure we all been through this. Our alarms are going off and like we never wake up. So like there could be a chance where you just like miss your alarm and
Yeah, well, I don't think I wouldn't die. Like we can go a little bit without any cortisol. Like it's not immediate. When I was diagnosed, I wasn't well for a few months before that. The problem is if you're say I forgot that pill and I'm at 0, but then I get a fever or I start vomiting. Well, it's the symptom of not having enough. So that's often what happens. Someone starts vomiting and then your body needs more, but you don't produce any. So then your body needs it and it's not there. And then like it's a vicious circle that starts and then you get into crisis. If at that moment I'm alone and I'm unable to get my meds or get an injection, then I could lose consciousness. And if nothing's done, then I could die. But just missing one pill and being at 0, what happens is I don't feel good at all. But I wake up and it's dangerous, but it's mostly that I don't feel good. So that's why I tried like taking more before bed or not waking up because cutting my sleep in the middle wasn't fun. But I do feel better when I take a dose in the middle of the night. But I'd rather, we have some people have a pump and they use a diabetes pump to get continuous medication, but it's not approved for that. It's not easy. I don't think I can have that here in Quebec, but so far I can manage it. So my doctors don't even go there because I'm okay.
so how long
And
have you been dealing with this issue then?
almost 3 years now. It's quite new.
Oh, so did one day all of a sudden you just started vomiting and
No, actually, about 2 years prior to diagnosis, I started feeling bad, and it felt like my POTS was back. So when I had finally my POTS diagnosis and my treatment, in a matter of a week, I felt so much better because my blood volume was back to normal with the meds. I wasn't healthy, but I was much better. And then, like, in 2016, I started again feeling tired, feeling not able to stand up a long time without fainting or, having to sit instead of fainting, lacking energy and losing my hair. And I think that's mostly the symptoms I had. I did not lose weight. That's a hallmark symptom, but I did not have that. I did not go dark. It's another hallmark symptom that I don't have. But then again, I have Ehlers-Danlos Syndrome where the skin is almost translucent. So it was competing in my body. So I can't have both problems at the same time. So, and I had cardiovascular issues. So I had tachycardia and I had blood pressure issues. So we did a lot of investigations, and eventually I can't remember if it was my cardiologist or my endocrinologist, but most had been ruled out, and they thought about that. They tested that, and they found the issue. I'm one of the lucky ones for whom it's found that way and not in the ER because of a crisis, because that's what usually happens. People end up unresponsive, or they have a car accident and it's even worse and they can't find out why, and then eventually someone figures it out. But I was lucky that they found it before it was too late.
So how do you actually get diagnosed? Like, there a blood test to check for cortisol levels?
Exactly. Yeah, it's a blood test, and usually they do one more blood test. Like they kind of they give you something to try to have your body produce cortisol, and if that doesn't even work, well, then they know if it's a primary or secondary problem. But it's how they test. It's a blood test.
Well, what makes it confusing, like, let's say, like you were saying, that you need to, if your levels are low and you are unconscious and you need the shot, and since it's a rare disease, could you die because it's so rare that no one would consider that you have, like, if you go to the hospital, like, would they automatically test you for low?
No. Sadly, it happens that it's discovered in the autopsy. It also happens, sadly, and I kind of hate talking about it because it feels dramatic, and I hate scaring people who have this, but at the same time, they need to know. It happens that you're in the ER and you need this because you've been diagnosed, and the staff refuses to give it to you because they don't think it's important, because they don't understand how it works. And some people have died because of it. In the UK recently, last year, there was I don't want to, kind of a guideline that was issued after a study they did, because they found that too many people died because of that. Like someone going in for a broken leg and going into crisis and being refused their meds and dying because of the adrenal insufficiency. And so now in the UK, they have like a special card, and it's automatically in their, I don't know, I guess their system is all on computerized or something. And so they use this system there of cards, not just for this, but for other health issues. And so they have that card that if they present this, the doctors will know what to do. But it doesn't work everywhere. It had to, many people had to die for this to happen.
If I was like a smart person, like, let's say you tell me that I need this cortisol shot, like, let's say, like, I didn't believe you, but like I could just take the blood test and it say, oh, her cortisol levels are, close to zero. Like, hell yeah, she needs this shot. Like, wouldn't that be the best? Like, it would be better to rule out that she's not crazy instead of just refusing you completely.
I know, but I don't know exactly how those, all those cases happened. But I know when I was in the ER and it was refused to me, they didn't even consider testing at that moment. They just, at one point in the OR, the nurse told me I had enough meds already. So she thought it was like a pain med or something. She did not go see a doctor to ask if I was right. It didn't go further than that. And I was on the surgery table in having trouble breathing, and knowing that was probably the reason, because it's one of my main symptoms when I really, really need more cortisol. So lack of knowledge.
So it's, yeah, ignorance and
not respecting the patient, not thinking that they might know what they're talking about too. That's another problem.
I mean, you're also very specific. It's not like it's a very specific drug. So it's not very like it's not like you're asking for Advil. Like, that makes sense. Like, if someone's like, give me Advil, like that. Like, you're just very specific. Like a crazy person not gonna go and say, I need cortisol, like, so specific.
Yeah. But the problem is cortisone. Well, it's the synthetic is cortisone. It's the same thing that you get an injection like in the joint for pain, but it's not used the same way, and it's not the same compound, I think. So it's called Solu-Cortef. So it's like the meds I take in pill form, but in liquid form. But also prednisone is one of the pills that some people take daily. And prednisone is sometimes used as an anti-inflammatory for some people, like with rheumatoid arthritis, for example. And so people who don't know really well, they think it's an anti-inflammatory, so they associate it with pain. They might not even realize it's an anti-inflammatory. They just say, oh, people with arthritis take this for pain, so if you want it, it's for pain. They don't understand that we don't use it at the same dosage, and it's not for pain. I've had a doctor, an endocrinologist, it's their specialty, and she told me I should not use it for pain. And I was like, I wish it helped for my pain. That's not at all what I'm taking it. And I don't take more, it was crazy. It's scary when
Yeah,
doctors
I mean,
act that way.
if you really needed cortisol, it's like why does she have a bottle in her purse and a syringe needle? Like she's not just gonna carry that for just because. Like
No.
you would think it's a little important, That's just so. I'm sorry you had to go through that.
Yeah, that's a big motivator to do advocacy.
Well, I don't know if it happened to you, but are you ever in like situations where, like, if you're delirious because of X symptoms, do they listen to you, or or do you need someone else to tell them?
One time when I was in the ER, it was pre-COVID. I wasn't too much pain. I wasn't delirious, but I was like in too much pain to try to talk, and I didn't even want to try. And my dad had my endocrinologist on the phone and was trying to tell them I needed more meds. Well, not more pain meds, but just cortisol, my Cortef. And they had given me some like over 3 hours prior. So I needed more then, and they were refusing. And so my doctor, my endocrinologist, was on the cell phone, which I'm very lucky that I have that I can call him, and that he called back, and they were refusing to take the phone to talk to him. And so my dad kind of started talking a bit louder because he was going crazy, like, I'm starting to lose consciousness because I was lacking my cortisol. And their response was to threaten him to have him removed from the premises because he wasn't respectful.
Oh my God.
Yeah, so not respectful, but just talking too loud. I understand we need to be respectful and not like get angry, but his daughter was possibly dying, and we had the doctor on the phone, and they were just dismissive. So it was really crazy. So they don't listen always.
Oh my God, man, I'm so sorry that you had to go through that.
It happens.
I mean, I've been talking to a lot of rare disease people, and everyone always had their own medical issue, problem, story of not being respected and not being listened to and being called crazy. And it's like our health system is great in certain areas. Well, I mean, it's also weird because we're also in different countries.
So it's the same everywhere.
Yeah, but it's literally the same everywhere. Like talking to someone in South Africa, the same for her, same for the United States, same for Canada.
Yeah.
Since you mentioned Canada, how is healthcare for you? I know that sometimes they say like, oh, if you want to do like a surgery or something, you have to wait 6 months.
So 6 months is quick.
So how is it for you? Like, is it a benefit or is it?
Well, it's not perfect, and the big issue is the wait times. But I wouldn't trade for example, being in the US, because I don't have to worry about cost. It's not all free though, because obviously they don't pay for everything. We need, we have insurance, and even with insurance, we have costs because they don't cover all the meds. Some meds are not covered at all. Some procedures or braces are not covered even with the insurance. So, it's when they say healthcare is free, it's like much more free than in the US, for example, but it's not totally free. But the most problem is the healthcare system is not working great, and the wait times is the most problematic. What I always say is it's much better than elsewhere, but we still need to improve it. We can acknowledge that there are problems still. For example, I need an abdominal ultrasound, and my doctor asked for it last May. I called the hospital this summer to ask, should I take it to the private sector? If I can. And they said, oh yeah, your request has already been sent to the private sector because the wait times is over 2 years now.
Oh my God.
And I was just, of course, it's worse now because of COVID. It wasn't, but it was still probably over a year prior. I don't know, and so I called the private clinic and I got an appointment in 3 weeks.
Wow.
And I'm like, this shows how broken it is, because it's the same patients, it's the same, it's just that some doctors are in the private and some doctors are in the public. So it's just not working. There's clearly a problem in the organization. But other than that, the care is good. It's the same doctors. It's not worse or better.
I mean, what's dangerous about the very community, that time is of the essence. If you're waiting 2 years for the ultrasound, that could be 2 years of you suffering. And like I mentioned before, like rare diseases, the domino effect, you waiting 2 years, you could develop something new that if you had it 2 years ago, it wouldn't have started. But now you wait, and now you have the previous issue, but now you have a new issue. And then now you have to wait another 2 years for another MRI or something.
Yeah. Well, it's often the problem. I call it the 3 months, not problem, but it's the way they work. Almost every doctor you go to, let's say, even without a rare disease, I'm healthy, I have a new issue, I go see my doctor. Let's say I have a sprained ankle that won't heal, so I go to my doctor. He will say, okay, it seems like a normal sprain. Let's see you again in 3 months and see if it's okay by then. And I go see him again 3 months later and say, oh yeah, it's not healed, so let's run some tests and see you in 3 months. So you run the test and you see them again in 3 months. It's been 6 months since the first appointment. And then you'll say, yeah, you have a problem. I'll refer you to a specialist. And so it's been 6 months. Now you have the referral, and the specialist, well, it might take 6 to 9 months to see them. And then the specialist will say, oh, I need those and those tests. And it might take 1 year to have those tests done. And then you'll see the specialist again with the tests, and then he'll decide maybe you need a surgery. But it's been 2 years that you have the problem. So that was before COVID. So, but it's often the 3 months and 3 months, and to see the evolution, and especially not order tests too soon. Sometimes I'm like, yeah, but you will ask for tests, order them now. Mm-hmm. If I don't need them, I won't go, but at least ask. But they really don't want to do that.
You're making Canada healthcare sound so bad right now.
But it's not, because, for example, when I had my precancerous condition last summer, they discovered it in June and I had my surgery in November. It would have been sooner but COVID. So, but it was still quite fast, and it didn't cost me anything. And for those, really nothing. So I I didn't have to worry about doing the test or seeing another doctor for a second opinion, or I didn't have to worry about that. So I think that's important, especially for people, with a rare condition, or when you have a misdiagnosis and you need to look for more, ask around. I've heard of many who don't have the money to to get a second opinion or to find what's wrong with them. And it makes me really sad. I understand, but it makes me sad.
Yeah, Canada is very I had like its pros, like big pros, but it had this huge con,
Of
and
course.
it's
Yeah.
it's hard to say what to choose. But I do get that it's very expensive, and the stress of not having to worry about paying is huge for a lot. It would be huge for a lot of people.
Yeah. I
On
would
top,
definitely fix it though.
yeah. Before I take the mic away from you, is there anything you like to say or promote or anything?
Yeah, that would be one thing. One big part of my advocacy, and I think is giving me and should give others hope, is I do work a lot as a patient partner. And one of these occasions is working with future doctors and future healthcare workers, including with the Montreal University Faculty of Medicine. And I teach workshops, and I do one-on-one with them, well, with some of them. And I always, stress with them the importance of listening to the patient and what we can bring to our treatment plan, and that not all patients are the same, even with the same diagnosis. And it usually, they're really, really interested, they're willing to learn, and it's even called the Montreal model, that way of working with the patient, not for the patient, but with the patient. And I have hope that things will change. It won't change in 2 years. It might take 15, but it's getting there, I think.
Thank you so much. You have a lot of great articles online. I'll definitely
Thanks.
link everything in the description below. I want to thank you everybody for listening and watching, and I'll catch you next time. Bye bye.